we suspect that from one of these things, blood poisoning or the airway, the throat that is closed off, or heart conditions, we would suspect that several people die each year in Liberia from dental infections that could have either been treated or, better yet, even prevented. So let's talk more about that. Frida, tell us what people can do to prevent these infections from occurring.
Any one of you listening could tell us what the first thing is that you need to do, and that is to brush. 2 things to remember: brush with a fluoride toothpaste. And then one thing that's very different, that's not general knowledge now, but you're all going to be learning this: brush before you go to sleep. If you're only going to brush 1 time a day, the most important time is to brush before you sleep so that you're sleeping with a clean mouth. Then also, too many sweets can really do damage. I see a lot of children walking to school with a sweet in their mouth, with a lollipop, with something in their mouth. And that means they're going to be sitting through the whole day in school with this sweet stuff on their teeth. And that's causing a lot of problems. Another one would be, keep in mind, don't just wait to go to the dentist when you feel pain. Why not prevent it? Go for a checkup, or when you're looking at your teeth, you see a small black spot in your teeth, come to us, have us check it out. If it needs a filling, it's so much better to put in a small filling to remove the decay and put in a small filling than to wait until the tooth breaks and begins to cause pain, because then often the tooth has to come out. It's so much better to try to save the tooth. And if you do have pain in your tooth and you suspect or you know that this tooth is going to need to come out, don't let someone talk you into just, oh, well, the pain is going to go away. Because as we talked before, the pain may go away for a while, but when it comes back, it's always going to come back much more serious, much more difficult to deal with. So take care of it right away when you can. Treatment for us, the treatment that we give you, is much easier for us before it's too severe. So it's easier for you and it's easier for us to treat you as well. So don't wait.
Yes, and we're talking about prevention here, which is things that we do to keep something from happening. So prevention is not something that you do to treat something. In other words, you already have the pain, then you go and get something done about it. But prevention, and so one of the things I want to tell you is medication that you can buy on your own on the street or from a pharmacy, that is not prevention, especially amoxicillin. Okay, amoxicillin, yes, is used to treat some forms of infection, and the doctor may prescribe that, but if you go and take that yourself anytime you have pain, that is actually worse for you, and not only you, but your community as well, because what it does is it makes the germs that we talked about earlier, the bacteria, it actually makes them stronger if you take that medication too much. So again, to repeat, prevention, like brushing and having a filling done or having your teeth cleaned, those are steps we can take to stop this from happening before it starts. But to take medication that you're not really familiar with, or you just take it because you're having a little bit of pain, that is not prevention. That is actually making matters worse. So don't take medication unless it is given to you by a doctor and you are told exactly how to take it. Okay, well, we want to close today's show by doing something that we may do in the future as well. We want to do something called dispelling a myth. And a myth is, if you don't use that word here, that means a story or something that is not true. And so today we believe that Jesus said he came to bring the truth, and the truth will set us free. So we want to give you some truth to a story that we have heard many times here that is not true. And that myth today, or that story, is about the extraction of wisdom teeth.
Many people are very worried that if they have their last tooth, the last molar on the top or the bottom removed, that can cause death. That is entirely wrong. In fact, an infected wisdom tooth that is not extracted would be far more likely to cause death, for all of the reasons that we have discussed, that we've been talking about: the septicemia, the blood poisoning, the infection, the swelling of the throat. These are all reasons why it's important to have that wisdom tooth removed if it's causing an infection.
Thank you, Frida. Well, we want to conclude our show today, but we want to remind you of a challenge that we gave you last time, and that was not to deny your whole health. In other words, don't just take care of your physical body, but also your spiritual body by making time to spend with God each day, talking to Him and learning from Him, hearing from Him, and getting to know Him better. I hope you're all doing well with that challenge and continue to strive to do that. Again, Trinity Dental Clinic is located in the front of ELWA Hospital in Painesville. We open at 8:30 Monday through Friday. And on behalf of the entire Trinity Dental Clinic team, we thank you so much for listening. And our prayer for you is a healthy life through the wonderful knowledge that God has granted us. Thanks for listening.